Uh, Secretary, please confirm if you're able to hear me clearly and see me.
Sir, evening.
Good evening. Good evening. Shivan, you're able to hear me?
Yes, sir.
And also I'm clearly visible, right?
Yes, sir.
Perfect. Thank you so much, Shivan, for confirming that. And I can definitely see that our esteemed speakers, panelists, and our attendees have joined in. Just taking 1 minute for basic housekeeping and then we start. In the meanwhile, I really extend a very warm welcome to our esteemed speakers who have already joined in well on time. Dr. Bhaskar Vishwanathan. A very good evening, Dr. Bhaskar Vishwanathan and Dr. Rishabh Kumar. Such a pleasure to see you both here.
Good evening. Good evening.
Very good evening and a very warm welcome.
Namaste Shivaya.
Thank you. Just allow me a minute for basic housekeeping and then we start.
Yes.
Okay. Yeah. Okay. So very good evening to everyone. Extending a very warm welcome on behalf of Association of Environmental and Occupational Health Delhi, branch of Indian Association of Occupational Health, body which is approximately 3,000 plus strong key occupational health physicians and healthcare practitioners of the industry and work as a backbone to the workforce of major corporates and giants of India when it comes to organization which move India's economy, like all Maharatna companies, SAIL, BAIL, GAIL, NTPC, ONGC, those kind of organizations, then Navratna, and then Mini Ratna. And then comes the sector which comprises of private organizations, be it Reliance, be it Tata, be it L&T, Vedanta, Ken Energy, Hero MotoCorp, Maruti Suzuki, you name it. And most of the physicians and the doctors who are associated, who are actually keeping the employee and the workforce healthy and also keeping things environment friendly, they are part of this organization. And we are very privileged that esteemed speakers like Dr. Vishwanathan and Dr. Rishabh, you keep coming to these forums and keep us enlightening on the aspects of medical science, which we at times feel that we definitely need to learn, and this is a continued learning platform. I really thank all the panelists who have joined today and all the attendees. It's a great pleasure welcoming. I am Dr. Pawan K. Gupta, part of in Delhi branch as executive team member, part of the national body as web secretary, and secretary of Haryana branch of Indian Association of Occupational Health. It's an absolute pleasure. As I mentioned, we have covered this milestone of completing 104 webinars on this platform. It has been a continued endeavor since last 2 years during the pandemic time. And there are many stalwarts who are behind this. I'm just a moderator. I'm just one little drop, not even a drop, I would say, but have been trying to contribute best I can. A very warm welcome to you, to both of you, esteemed speaker. We are really thankful that you have spared your time this fine evening. And amazing topic that you have chosen. I'm sure we all are going to learn. As far as the attendees and panelists are concerned in this today's webinar and today evening, this fine Saturday evening, we join in as and when we get time, and then if we are short of time and we are not able to join live, then we go on our digital platforms we have our YouTube channel, we have our social media platforms, and this entire scientific sessions, we are creating kind of encyclopedia, and it's our pleasure to say that 104, you can imagine those kind of sessions. We have a lot of science in that is available on our platforms, and we always urge all occupational physicians and practitioners to please find time to visit those platforms and enlighten themselves as and when it is needed, or learn from or exchange thoughts. So it is not limited to this audience. It's a very broad audience. It's a national and global platform, I would say, wherein we are trying to communicate with the entire global community when it comes to occupational health and the environment as well. So that is a brief introduction of the organization, about me, and what we have covered so far. Secretariat has played a key role in doing this during this pandemic time, and I'm really thankful to the Secretariat. At the same time, I'm really thankful to the executive body of Delhi branch, that they have given me this privilege to host and moderate this session. With that, I would announce the topic on which our esteemed speakers are going to deliberate and present. It is recent advancements in radiation oncology, technology, and their scope of work. I would say brilliant topic and very modern, and this is what at times we need to learn. With that, quick submission on how we will interact during the webinar. Please keep raising your hands, keep putting your questions in the chat box. I will try to do all the justice in the order and the sequence in which they have appeared on the screen, and we will take up all the questions. It will be taken up during the later part once you have done, when the speakers have given the presentation and the deliberation is done. And in the order of their appearance, we will take all of them if time permits. And yes, we look forward to a good deliberation. With that, Dr. Vishwanathan, I would like to introduce to you, and also Dr. Rishabh Kumar. I will run a brief profile of your definitely your achievements and backgrounds to the entire audience, and then I will this entire platform will be all yours for deliberation and also for your discussion. So, quick introduction to our first speaker of the day, and I'm sure Dr. Bhaskar Vishwanathan, you are going to you are going to take it up first, and then followed by Dr. Rishabh Kumar, right?
Yes.
Thank you so much for confirming that. Our first speaker of the day, Dr. Bhaskar Vishwanathan, is presently working as a professor and head of the Radiation Oncology Department at Amrita Institute of Medical Sciences and Research Center, Faridabad, Haryana. And with that, I would like to really thank Amrita Institute for collaborating with us, for partnering with us, for associating with us. It's the first time that we are coming together, and I look forward on behalf of the organization to have more such interactions. I'm really thankful and gratitude for this collaboration and association on behalf of the association. Thank you. Dr. Bhaskar has initially did his schooling at Frank Anthony Public School and College at National College in Bangalore. And later on, his MD training was at Kidwai Memorial Institute of Oncology in 1997. He did a one-year clinical research project at Tata Memorial Hospital in Mumbai in 1998. And then followed by, he has also been part of PRSG Committee of Department of IT, BT and Electronics, the IT Government of India as cancer expert to oversee research, audit in cancer nanotechnology research at IIT, Mumbai. He also had an orientation program on hypothermia techniques in breast and cervical cancers at Erasmus MC Netherlands in 2017. A very warm welcome to you once again, Dr. Vishwanathan. Thank you so much for sparing your time.
Thank you.
And followed by, I would like to quickly introduce our second speaker of the day in sequence, because both of you will be taking up the discussion, Dr. Rishabh Kumar. Dr. Rishabh is a radiation oncologist with 8 years of experience in this technology and patient-driven field. He specializes in using advanced forms of radiation to treat cancers of the brain, head and neck, breast, gastrointestinal, and gynecological regions. He received advanced training to deliver high precision, personalized radiation to kill cancer and cause the least amount of side effects. That's amazing. In 2017, he was awarded a technology transfer grant by the European Society of Therapeutic Radiology and Oncology to learn about cyber knife-based SRS and SBRT, proton therapy, and hyperthermia at Erasmus. I would say that those are really great achievements to our esteemed speakers. And as I've been saying, I really appreciate your kind gesture of sparing your time this fine evening. We are open to learn, deliberate, and also bother you with our queries. The Z platform is all yours. Thank you so much for joining us. Please.
Thank you for such a kind introduction.
Thank you.
And thank you for having us.
Thank you.
Can you see our screen? Is our screen available?
Yes, I can. It's visible.
Wow.
It's a home screen of Amrita Hospitals.
Yes.
And you can probably switch it to presentation mode. Yes.
Now
Yes.
it's seen?
Yes. Yes.
What?
Very well.
Okay. So Dr. Bhaskar, all yours.
This one is it? Om Namah Shivaya.
Om Namah Shivaya.
I would like to first of all thank
Om Namah Shivaya, sir.
Om Namah Shivaya. I would like to thank our esteemed Honorable Chancellor, Mata Amritanandamai, for giving us the trust and giving us the enthusiasm to take forward the clinical services, as well as the field that she so much loves, research in clinical sciences and basic sciences, to help mankind. So I would thank her again for the enthusiasm she has and the trust she has given us to take this entire project forward. So Amrita Institute of Medical Sciences and Research Center is a new facility which has come up at Faridabad. The parent institute is at Kochi. And this facility has 2,400 beds with 81 specialties, lying across 133 acres of sprawling Health City campus and 5.2 lakh square feet for the medical college. It is 64 fully networked modular operation theaters. It has smart ICUs with 534 critical care beds, which are digitally monitored around the clock. And the largest pediatric super specialty center, state-of-the-art, fully automated smart laboratories, most advanced medical imaging services in the country, and high precision radiation oncology, the largest of its kind in the country, with which we are associated with. India's largest, latest, and most advanced physical medicine and rehabilitation center. We also have a center of excellence for nuclear medicine in diagnostic and therapeutics. And it's also going to have the largest center in the country for the robotics, haptic, cadaveric, high fidelity surgical and medical simulation, and the largest single floor space in a hospital dedicated to mother and child care, comprising of fetal, reproductive, and high-risk obstetrics with most advanced neonatal care, and state-of-the-art cardiac and interventional cath lab for clinical services, largest facility to handle infectious diseases, and a dedicated research block comprising of 7 floors of 1 lakh built-in square feet area. So with this, I would like to move on to my profile, which has already been enumerated. I'll just skip this slide and move on to the next one. So our fields of expertise lies in, we would like to be treating with precision-based individualized radiation treatments in cervical cancers and head and neck and prostate cancers. We'll be using image-guided intracavity interstitial brachytherapy for all the cancers of the cervix, head and neck tumors, and other regions in the body. And also we are going to have the intraoperative MRI-guided brachytherapy procedures, which will be done. I'll be coming to that in detail in the next few slides. And high precision adaptive radiation therapy treatments, and also for the inspiratory breath hold techniques in treating breast cancers, and also the innovative image-guided robotic brachytherapy procedures, hypofractionated radiation schedules, which of course, as you know, in many centers, they just delegate them to the cancer patients to either palliative care or radical care, and that's it. But we are not going to do that. We are going to see what would be the response, even if the patient comes to us in a palliative setting. Could we really offer him radical treatment after initial assessing the initial response of the patient and converting him to a radical setting? And also we'll be looking at research into nanoparticle targeting of cancers by using induction heating. So I had been in Kidwai Memorial Institute of Oncology based in Bangalore for almost 8 years as assistant professor. I gained vast experience in treating cancers in all sites. I was very much privileged to be there because of the service which I rendered there to all sects of the people. I gained a lot of experience in treating them. At that era was mainly cobalt machine driven, and we used to treat a lot of patients on cobalt machines. And at that point of time, there was a transition from the cobalt era to the linear accelerator. So we did a lot of external beam treatments to the patients using 2D at that time. And later we moved on to the 3D treatments and IMRT treatment subsequently. And we gained a lot of expertise in brachytherapy, be it in carcinoma of the cervix, head and neck, or prostate. And previously we used to treat by LDR modality, that is low dose rate setting in the brachytherapy procedures for the carcinoma cervix patients. And of course, we later moved on to the high dose rate treatments. And we were there for modulating the entire thing, shifting the transition from the LDR to the HDR using various modulations. And this is one of the slides which shows that we were the first in the country to actually, first in the world, as we could say, that we developed this technique of doing interstitial brachytherapy, which would be, I mean, the problem was the patients who came in to us were from far-flung areas, and they were not able to stay in the campus for 4 to 5 days, or rather for weeks together, 3 to 4 weeks, which was a convention for delivering brachytherapy. But we, as such, took that problem in our stride, and we addressed that by treating these patients continuously for 4 days. And that has never been done, but we couldn't find any problems with that. The patient could tolerate well, and the response was very much equivocal to the conventional weekly treatments of interstitial or intracavity treatments. And later we also had huge patient load from Karnataka, the northern Karnataka, wherein which they used to eat these jowar rotis, which were stored for weeks together. And that used to cause a lot of fungal infections. And long duration of this sort of a diet led them to get fungal infections in the esophagus, and due to which that led them to have carcinoma of the esophagus. And we had a lot of patients with this sort of a disease, and we treated them with intraluminal brachytherapy, though intraluminal brachytherapy now for esophagus is not much practiced because of the concomitant chemotherapy which is given along with external beam. So that's it. And we have also been treating a lot of patients with intraoperative brachytherapy, and we're the first in the country to start intraoperative brachytherapy for head and neck tumors, especially if the site of the lesion is somewhere in the retromolar trigone. The surgeon would not be able to take out all the disease because of the invasiveness of the disease posterior to the retromolar trigone. And in this setting, we thought we could place the brachytherapy sources during the treatment or brachytherapy wires for facilitating us with interstitial brachytherapy so that we could take care of the disease, microscopic disease, which has been left behind and which has not been adequately addressed by surgery. So coming to this slide, when later I shifted to Vaidehi Institute of Medical Sciences in 2008, we did a lot of hypofractionated treatment, as I was previously telling you, to convert these palliative patients into radical settings. And we could gain a lot of success in that. And we are going to do that here in Amrita, wherein which we have got a big armamentarium to address this in the form of high-intensity focused ultrasound, hyperthermia, as well as the lasers. So we could do a lot of things here. And I was also able to get around 60 lakhs of donation from the Karnataka government to set up a nanoparticle lab. This grant was mainly to push the research in the nanoparticle front. And I could devise new sort of formulation of iron oxide nanoparticle, which would be tagged to the gadolinium. So that my idea was to take this gadolinium nanoparticle to the tumor sites along with the iron oxide and later induce heating by external induction treatments. So this is a very new innovative treatments, and I've done a lot of studies on animal models, and I could get some sort of a response from that, and we would be taking it forward here in our radiobiology lab, which we are going to have in the future. And we also had this very much interesting technique of I conceptualized and established the robotic brachytherapy facility. I will come to that. This is what you're seeing. The picture is the innovative setting of a robotic brachytherapy, which I would like to describe in detail in the next few slides. So this was a case scenario in which we had a 10-year-old or 7-year-old girl with a large tumor. As you should see, this is the big tumor here. This one, this entire is almost 14 centimeter size, occupying the liver, and only she's got a small normal liver tissue available there. And so she was treated with TACE and chemotherapy, and it progressed. There was nothing else to do for her, and she was referred to us if we could give external beam radiation. But that would be a challenge to treat such a big volume of the disease. So we were just thinking how we could address it, and we came up with a new idea of doing it with a stereotactic robotic brachytherapy, which is guided by a robot. And we individualized it to this patient, and we were the first one in the world to formulate this sort of a technique, wherein which we could place interstitial catheters into the disease area of the hepatic carcinoma, hepatic cell carcinoma, and we could get a very good dosage due to this, and the patient did fairly well, and she could get a very good response. On the left, what you see is a PET CT scan of the patient taken pre-treatment, and you could see the huge volume of the disease there, the 14 centimeters, that was the entire volume of encompassing the liver. And after the procedure of interstitial brachytherapy, what you see on the right, it was taken 6 months later, there was a complete response, which we ourselves couldn't believe that this could be, this could be so much contributory to the responses. And later, the patient, of course, did very well. She was totally free. Local control was there for 2 years, and she later succumbed to the disease due to the metastatic disease in the liver, in the lung, sorry. And of course, we did another patient of an elderly person of CA rectum who had a single metastatic lesion in the liver, which we could again target very nicely and precisely in the center of the tumor. We could place the radioactive source. And of course, after 2 years, again, he was also, this was the What you could see, this is the lesion there, which we exactly in the center, without duplicating. The first time we could place it there without removing it again, trying it and all that. So he had a very good response. After 2 years, again, after 6 months, this was the case, and after 2 years, he's still alive and there's no problems at all. He's surviving. And naturally, we have patented the device. And this would be my last slide, I suppose. So we have got, in the Department of Radiation Oncology, we have 10 bunkers, which is the largest of its kind in India. 8 are for teletherapy machines, 2 are for brachytherapy. We've got 3 CT simulators, 1 MR simulator, and a PET CT simulator and PET MR simulator, which we are all going to use this for the radiation simulation, as well as an intraoperative brachytherapy with MRI, intraoperative brachytherapy with ultrasound guidance, and 2 dedicated OT for brachytherapy, which will be integrated with HDR. And we are going to work very cohesively with the surgical oncologists. And we are going to have a radiobiology lab with, of course, a dedicated animal irradiator, in which we could irradiate the animal and take a scan of it in the machine, in the device itself. And we're also going to have a translational oncology lab and radiation physics lab. The scope of services would be brachytherapy. We're going to cover in all sites, including the brain. We're going to have a very big collaboration with the neurosurgeons for that. And we are going to have IGRT with TOMO or TrueBeam facilities, IGRT to all sites, SRS and SBRT, and online adaptation, and total skin irradiation by electron therapy, and total marrow irradiation, total body irradiation, and TMLI, and radiotherapy to all benign diseases. And of course, this would be the end of my last slide. And I will be handing over the presentation to Dr. Rishabh.
Good evening, all. Namah Shivaya. I hope all of you can see me and hear me. There is no problems with that. Can you please confirm?
Yes.
So Namaskar, we can see you and hear you.
Yeah.
Wonderful. So I'm Dr. Rishabh Kumar. I am an assistant professor in the Department of Radiation Oncology, and I work closely with Dr. Bhaskar. So this is my brief journey. I basically did my MBBS in 2006 from Pondicherry, and I started developing my interest in oncology from the year of 2012. I finally did my MD under Sir in 2014, following which I went to Rotterdam, Netherlands for a fellowship. And then I joined SGPGI for some time, and then I established the department at ILBS New Delhi and commissioned the entire linear accelerator at ILBS New Delhi, followed by which I joined AIIMS New Delhi and I have been there for the past 2.5 years, and now I've joined as an assistant professor at Amrita. So the future of radiation oncology practice. So first of all, I don't know the mix of the crowd, but I'll just give a brief overview about radiation. So radiation is nothing but electromagnetic radiation, which we see all around us. I mean, we can't see it, but it is present all around us. Radiation causes DNA damage, and the DNA damage kills the cancer cells. And with this, it is a very strong treatment that we have in our cancer armamentarium to kill cancer. So to give you an idea about the power of radiation, 40% of the cancers are cured by surgery, 10% of the cancers are cured by chemotherapy, and 40% of the cancers are cured by radiation. So radiation cures the same amount of cancers as surgery, and also potentiates surgery in the form of adjuvant or neoadjuvant treatment. So it's a very, very big and an important part of cancer treatment. And here at Amrita, we will be following precision oncology, personalized radiation, evidence-based medicine, and we will follow quality over quantity. So Dr. Bhaskar spoke about the bunkers. So in one of these bunkers, we are getting the most advanced linear accelerator available. We are getting the RadExact with Synchrony, along with the online adaptive module with tumor tracking. So what is this system? So this system is basically a system which can track your tumor movement. And it can track your lung cancer movement, liver cancer movement, prostate cancer movement. And how does it help? So once the tumor tracks, our volumes reduce. Once our volumes reduce, the dose to the normal organs reduce, and that allows us to give a high dose to the tumor and a lower dose to the normal tissues, and that results in a better local control. This kind of machine we will use for complex treatments. We will use for hippocampal sparing whole brain RT. Now for whole brain RT, the standard of care is either stereotactic radiosurgery or hippocampal sparing whole brain RT. We do not give open field whole brain RT for brain metastasis because it causes a lot of neurocognitive decline. The same machine will also be used for complex IGRT cases for breast radiation with regional nodes, and it reduces the hard dose. And as you would know that the breast cancer mortality depends upon the radiation received by the heart. So this machine allows us to reduce the dose to the heart, and hence improving the overall survival in breast cancer, which is rampant in our country. And most importantly, with this machine, we become the first center in the country to have online adaptation with KVCT. So what this basically means is, every time the patient goes on the couch, we do a diagnostic quality fan beam CT of the patient. We see for any movement or change in the body's anatomy or the tumor's motion, and we replan the patient based on the anatomy of that day. So that gives us ultimate precision, gives very high dose to the tumor, and reduces dose to the normal body. We also have a very strong bone marrow transplant program, and we will be using total barrow irradiation and total body irradiation to potentiate the same. This is an example of how helical tomotherapy helps. You can see here in liver, we have multiple lesions, and how beautifully the tomotherapy is able to spare the normal tissue, and here it is able to not spare the normal tissue in a conventional neck. Here in total marrow irradiation, we are able to spare the liver, the kidney, and treat the bone. So that's how this tomotherapy is going to help, and we're going to offer this to all our patients in whom the things are indicated. So with the great power comes great responsibility. With such technology, we need to have some backing to use this. So as I told you that with in ILBS, I commissioned the stereotactic program, the stereotactic radiosurgery program, and we have multiple original articles published from our work. They have been all published in reputed peer-reviewed journals. All of them are original articles. None of them is a review article. And these have been published and peer-reviewed. So rest assured, we will do the same here. We're also getting a true beam with HTMLC and HyperArc. Now, the whole point that this is going to be a dedicated stereotactic radiosurgery machine. We will perform benign and malignant stereotactic radiosurgery with HyperArc. Now, what is HyperArc? HyperArc is basically, where we image and we treat at the same time. We use this imaging to confirm whether our anatomy is moving or not. And if it is moving, we will allow the patient to shift back into the treatment position. This is very important for stereotactic radiosurgery, where we give a very high dose to a very small volume. This true beam is also going to be equipped with DIBH, which is deep inspiratory breath hold. Deep inspiratory breath hold expands the lung, shields the heart with your lung, and it reduces the dose to the heart, thereby increasing the survival. We also are going to have gating. We're going to have offline adaptation and electron therapy with the true beam. As I said, this true beam is made for stereotactic radiosurgery. We have a 2.5 mm MLC here, HyperArc, and we will be using MRI-assisted radiotherapy. Now, coming to the most important suite that we are going to have in our department, and this is going to be first in the world. This is the intra-op MRI RT suite, where we are going to have a 3 Tesla MRI in the Department of Radiation Oncology. And we will work closely with the neurosurgeons, the neurologists to execute that. So we are going to have, so the image is going to look like this. We have an MRI in one room and the OT table in the other room, and the patient will be operated on the brain, or the brachytherapy will be performed, and the patient will then be transferred to the MRI. A real-time MRI would be done. If anything or any more surgery is required, the patient shifts back there and then, and we then do the surgery again. The same goes with brachytherapy, and we will use this for our intra-brachytherapy MRI, for our MRI simulations, for MRI-assisted radiotherapy, for MR HIFU and hyperthermia. And we are the first in the country to have a 4D MRI, which will volumetrically scan for the real-time movement of the body. And again, we have a complete expertise in handling this, because we, after Tata Memorial, have the largest series of MR-guided brachytherapy procedures in our country. This has been published in various reputed journals, and we have got a lot of acclaim for the same. We have our papers in Green Journal, Gynecological Oncology, Brachytherapy, all for MR-based brachytherapy. On top of MR-based brachytherapy, Dr. Bhaskar has already spoken about intraoperative, so I'm not going to talk about that. We will be performing robotic brachytherapy for liver and lung and pancreatic malignancies. And our OT is also equipped with ultrasound. So we will be performing ultrasound-based image-guided brachytherapy implants. So this is one example which I would like to show you. If you can see here, this is a case of buccal mucosa, a T4 disease with an angle of mouth involvement. The patient refused surgery because of the poor cosmetic outcome. And so the patient wanted to have radiation. This was done in AIIMS. And I implanted the brachytherapy catheters in this patient and also coupled it with external beam radiation. So without surgery, we were able to achieve this. The cancer went away completely. Cosmesis was maintained. Patient had, without the extra cutting of the lips, the cancer was completely controlled. And this picture has been taken at 1 year. Currently, the patient is doing well even after 2 years. This is another example of a varicose carcinoma, where we implanted catheters inside the ankle. This patient would have gone for surgery, but the patient wanted some good cosmesis. So we ended up giving radiation with brachytherapy. And this is the cosmetic outcome which we were able to achieve. What you can see is just a healthy granulation tissue. So this is the power of brachytherapy that we have, and we have the skills to do the same. Now, a lot of people always think that radiation is only for cancer, but the radiation was actually initially tried for benign diseases. And for benign diseases, we have the huge amount of indication there where we can treat AV malformations, hemangioma, pterygium, heterotropic ossification. But now the latest indication and the most important indication currently in benign diseases is ventricular tachycardia. So ventricular tachycardia, patients who are not responding to radiofrequency ablation or who are not fit to undergo that can very well undergo stereotactic radiosurgery. And we did the same in AIIMS. This is a patient with whom we treated with stereotactic radiosurgery. And this is the ablation zone which was mapped in the patient. So this is a very well tolerated treatment published in the New England Journal of Medicines, and it has dramatic results. Now, all of you would have heard of mother of foot. This is another patient which we have treated in AIIMS. Mother of foot, actinomycosis, and a patient come with leaking sinuses, stinking sinuses. The only option for these kind of patients who are refractory to medical treatment is amputation. But we accepted this challenge at AIIMS. We delivered radiation to this patient, and the results are to be seen. We were the first people from AIIMS to cure Madhura foot with radiation. So this is going to be a part of our ongoing trial, even at Amrita, where we will treat these refractory patients of Madhura foot with radiation, and we will be able to give, hopefully we will be able to give similar results. This is another patient of pigmented velonodular synovitis, again presented at AIIMS. We treated this patient with brachytherapy with a surface mold. This is the MRI of the patient. And this is the image after 6 weeks, after 3 months, after 1 year. And this is the cosmesis after 2 years. So radiation can very well treat cancer, but it equally can treat benign diseases when done in the proper way. So now this is what we have already done in the past. In the future, in the next 5 years, we are going to achieve personalized radiotherapy, where each patient would have a different dose prescribed to him based on his cancer biology. We will use radiomics, genomics to actually tailor the dose. We will have a radiation biology lab, which will help us to do the same. We will use artificial intelligence in radiation planning for target delineation, and we'll have an advanced brachytherapy center along with particle therapy. So this is what we are planning to achieve in the next 5 years. And I really thank you for your patient listening. I'll be really happy to answer your questions.
Much, Dr. Rishabh, and definitely Dr. Vishwanathan. The deliberations were highly illuminating. I can express gratitude and definitely loads of thanks for what you have shared today with us. Before I take up and proceed with the question and answer session or take the queries, I definitely would like to express gratitude and thanks for sharing the details about wonderful establishment of the facility. The details that you have shared, it is going to be one of the largest in India, as I learned, as we have known, as we move ahead to believe 4,000 plus beds, and there are a lot of information about this facility. And I am we are filled with the gratitude for to revere honorable and highly respectful Mata Amrita Anandmai for doing this and taking this ahead for the kind of service that she has taken up. We are grateful. Coming to the deliberation, I must say that amazing and illustrious publications. Thank you so much for sharing those. That the work has been claimed and published, and it's available in the public domain, and we can definitely go and have a look what you have achieved so far, and how we can benefit patients at large, and many things that you have done. First 4D MRI. Amazing. And I would like to learn more about it. Then you are the first one, probably after Tata Memorial, to and the second largest one to take few things up, which is quite inspiring, because we definitely need these things in India, and more such facilities, so that outreach is bigger and we are able to get the desired treatment for masses at large. Many congratulations and definitely loads of good wishes for what you have achieved and for your future endeavors. Those were some very inspiring and motivating treatment success stories that you have shared. I will not go into the detail of naming or taking, but I must say, first of its kind treatment, definitely they are globally acclaimed. They must be globally. The publications are available, and we will see how best it can be taken to larger audience. As I have mentioned, this is a digital platform, and the information is going globally from this platform, and we would see that people are benefited, and you will see further the deliberation that will happen once I open the session for question and answer. Yes, Madhura Food, as you have mentioned, one of its kind. Thank you so much for sharing the detail, Dr. Rishabh. This is going a long way. I must say, the first of its kind that you have achieved. Thank you so much on behalf of the organization for sharing those details. My only question, as we have two esteemed speakers, I will not take any time to have any more queries, but if you can throw some more light on 4D MRI, which is first of its kind, some more information maybe about the and about some commercials as well. It will be beneficial for our key panelists and also attendees and audience. Please.
Sure. So 4D MRI is the latest by Siemens, and we are able to volumetrically, when I say volumetrically, in coronal, axial, sagittal, in all planes, I'm able to get the live motion of the human body. So this we will use in liver cancers, pancreatic cancers, where we know that patients cannot stop breathing. So they will be taking they will be breathing normally, and when they need to be treated with radiation, we will use this entire moving platform to delineate the tumor, to get the information about the tumor, the movement of the tumor, and the movement of the normal organs, and then plan the radiation in such a way that we are planning along the track of the moving organs. And this can only be done the best on a 4D MRI, because the quality of a 4D CT is bad. 4D CT exists, but the quality is so bad that you cannot differentiate the tumor from the liver. So this allow us to treat for liver and pancreatic cancers, ones which move a lot, and we will be able to have a big success in doing that.
Okay, perfect. Thank you so much for answering and taking up that query. Definitely, I understand. Commercials can be taken up later. We'll be in touch. If some queries come to us, we will direct it to you through other channels and platforms, and we will see if we can support the people in need on that. With that, I'm opening up this session for question and answers. And before that, I'll move on to the panelists for their feedback, their comments, and also the queries and the questions that they have. So first, I definitely would like to welcome and open it for Dr. Sandeep Sharma. He is National Secretary, Honorary Secretary for Indian Association of Occupational Health, and he's General Manager, HSE, Indian Oil. If Dr. Sharma, you are available and you can hear us, please.
Yeah, thank you.
Thank you.
Dr. Pawan.
Thank you so much.
Both the learned speakers from Mata Amrita Hospital.
Yeah.
We are really very fortunate enough to have this hospital and the research center in our near vicinity. This will be of great help to the humanity. And regarding our organization, let me introduce to both our speakers that we are a 3,000 member organization, and we are all industrial physicians and occupational physicians across India. And we all are working in public sector undertakings, government organization, and private corporates. And most of us, we are medical heads of our respective organizations. Like I am working as general manager in Indian Oil Corporation, and our vice president, presidents, they are also medical heads in different organizations. So we are Delhi branch of Indian Association of Occupational Health, and we were definitely looking for such sort of facility in the near vicinity, because day in, day out, we come across our patients who require these sort of therapies. And with the advancement in the treatment of medical oncology, the facilities which are available both in medical oncology and radiation oncology, and even in surgical oncology like robotics. So all these facilities, they are available in NCR. But this 2,400 bedded Amrita Hospital flooded with the kindness of spirituality. This will definitely go a long way in helping the masses, our people, in getting the right treatment at the right place. And I really liked a few quotations which you all made, like you all will be preferring quality over quantity, because this was very much required in the world of commercialization. Then with great power, it comes the great responsibility. Yes, we all understand that as we all step up in the hierarchy, a lot of responsibility comes with the power, and same you all might also be experiencing, because since it will be a state-of-art center, it will definitely has to come up to the expectations of the population who require them. I would also suggest you all to work towards preventive oncology also.
Yeah,
Because
actually,
now,
We actually were thinking of having cancer awareness camps and going around the rural belts and the suburban areas to give them a feedback on how the cancer awareness.
So since we are all working in industry and our workers, they are exposed to various chemical, physical and other hazards. And now stress and obesity and many other these non-communicable diseases, they are also the leading factor for causing various cancers. So if we can do something for this also, because this is blessed by spirituality, your institution is blessed by spirituality, and we all now know that I have also seen many cases, and we have heard from leading practitioners that if you are positive in your attitude towards treatment of cancer, so in addition to the medicine and in addition to the therapy which is being given to you, your willpower, your positivity, it plays a great role. It helps in increasing the length of the telomere. It prevents unfolding of the DNA. It prevents expression of the genes, oncogenes. So a lot of things are there. So we have to work together with you all, and I think I should thank Amit Goyal for connecting with you all, and we would definitely like to visit your institute and this particular.
Dr. Vishwanathan, you're on mute. If you're saying something, you're not able to hear. Sorry, sir.
Okay, actually,
Yes.
what we were thinking is we would like to have a link with you all if anybody is interested to be part of our research, part of our clinical services. You are welcome to do that, and we can always meet up and
that's what I suggested to Amit also. Like all those medical heads who are all our members in Delhi NCR, we can plan a visit to your hospital someday.
Sure, definitely.
Maybe before your inauguration or after inauguration, whatever is feasible. So this can be a site visit with seeing the facilities, and even our vice president, she has already visited your hospital.
We will have
Dr. Mrs. Kamla Fatyal from NHPC.
We will
Amit
coordinate. Definitely.
So
surely, sir, surely
Amit
we
can
will coordinate and organize the same, sir. Very soon, sir.
Because
so we are planning after the inauguration, sir, because a lot of security is beefed up in the hospital, sir, because of the PM sir visit. So every day something, one or another thing is going on.
You can plan at your convenience. There's no issue.
Yes, sir. Yes, sir. Yes,
but
sir.
We would definitely like to together. We would like to go and see your institute, and
definitely, sir. Definitely.
And our association will go a long way with you all, sir, and best wishes from my side, from our association side, and this session will be it is live recorded and it will be available on YouTube for the benefit of our members across India. So thank you very much. Thanks.
Thank you so much, sir, for expressing your views, congratulating, and as well as being kind. Yes, please, Dr. Vishwanathan, you are saying something, please.
From our side, if you want to facilitate the screening in your places of work, that would also be helpful. We can always that we will plan, and that we will organize. There's no issue. But we want to do something concrete so that something research based can be done for our organizations. Because now new therapies are coming, and like earlier our medical rules they were saying the treatment is surgical, radiotherapy or medical chemotherapy, but now a lot of immunotherapies, targeted specific therapies, then proton therapy, then precision radiotherapies, all these things they are coming. So decision makers, they need to be made aware of all these new techniques, how they are helpful, and they are part of the basic radio chemo and surgery therapies only. So but guidelines which will help in, like, we are following NCCN guidelines, but your inputs will definitely help us to further take decision in giving the right treatment to the right people.
Absolutely, sir. Absolutely. That's an open and wholehearted wish list from our side, to come as close as possible, two institutes and two bodies coming together for the betterment of mass. As I can see what Dr. Sharma has expressed, and Dr. Vishwanathan, you have also expressed that you are definitely quite open and keen to take this ahead. Thank you to Amit, as Dr. Sharma has mentioned, yes, for bringing us together. And with that, I move on to definitely our key second panelist, Dr. Kamla Fartial, ma'am. She is the Vice President of AUHD, Delhi branch of IUH. Ma'am, if you are available and if you can express your views and your feedback.
Thank you, Dr. Pavan. Dr. Vishwanathan, Dr. Rishabh, thank you very much for that introduction about your department and the technology which you are bringing to Delhi NCR. I think we are looking forward to it. I had visited your hospital and you kindly showed me every facility which is coming up. I am looking forward to seeing more of it and learning more of it from you all. And I am very surprised to see that you told us that you are also doing radiotherapy for benign diseases. Even I saw cardiac ablation for ventricular tachycardia, tendinosynovitis, and some orbital pseudotumors, among others. So I think are all things which we will all love to learn. There's a lot we need to learn, I think. And with the advancement which is coming into radiotherapy, I'm sure our oncology patients will be benefited in the days to come. So we look forward to having more such sessions and learning from you and empaneling our organizations with your hospital. Thank you very much. Thank you very much, Doctor.
Thank you so much, ma'am. Yeah, thank you so much, ma'am, for being so kind and giving an open invitation again for the collaboration. Really appreciate that. Was ma'am, Dr. Kamla Fartial from NHPC, head of the medical services. Thank you so much. Moving on quickly to Dr.
I would like to add something to what Dr. Kamla was saying.
Please.
Yeah, so
Dr. Rishabh, we lost you. Okay, there is some network challenge. I could see Dr. Shriniket Mishra was available, but I think he come up with some occupancy and he looked out. Yes, now you are saying something, Dr. Rishabh. We lost you. Please.
We actually started the first phase 1 trial in India for low dose radiation in COVID-19 pneumonia. So when during the Delta wave, the entire country was, suffering. So we treated and reduced the inflammation of COVID-19 pneumonia of the cytokine storm with low dose radiation by just giving 1 gray. So radiation has a big role not only in cancer but also in benign diseases.
Amazing. That's whole new dimension, I think, that you have just spoken. You reduce the cytokine storms implications by doing radiation, right? If I'm understanding it correctly.
Yeah, we gave a very low dose of radiation, just 1 gray. So I give you comparison. For treating a tumor, we give 70 times the dose, 70 gray. But for low dose radiation for COVID-19, we just gave 1 gray. And we treated the bilateral lungs. With that, we got a good response in 70 to 80% of the patients. We were able to wean them off the oxygen, and we were able to wean them off, so normally we could wean them off of oxygen in 7 to 8 days. With radiation, we could wean them off in 2 days. The drastic oxygen requirement reduced. They were, 86% saturation, 90% saturation on 10 liters, 12 liters. 2 days after radiation, 2 liters of oxygen, 96% saturation.
Amazing. I mean, whatever little knowledge I have, I can only say this is amazing.
That is amazing. Very very true, Dr. Pavan. Even I too say the same thing.
Yeah, I mean, this is a whole new dimension that you've opened.
Our department in AIIMS has published this data in British Medical Journal also.
Wow.
Oh, great.
we are going to probably see how best we can communicate this information that you have just shared, Dr. Rishabh.
Dr. Saab, if you could share that link with us so that if you have that journal, we would also like to read about it.
Yeah, yes. We would definitely like to publish it on our various platforms that are available.
Amit, I think you could help us in.
Definitely, ma'am. Definitely. I will take
sending
Dr.
us in a
Rishabh and
neat
share
yes.
with all of you, ma'am.
Okay, yes.
Ji.
Thank you very much,
Thank you,
Amit.
ma'am.
Thank you.
Thanks, ma'am.
Thank you so much for emphasizing on it, because we will be sharing it all across the country with all the groups that we have, that this is the latest, this is a very key and crucial information. COVID is still not over, and definitely it will be of great help. Thank you so much, Dr. Rishabh, for sharing that. With that, I can see that we have attendees, and amongst panelists, we have Dr. Nishant Kumar and Dr. Negi. If you have Dr. Negi and Dr. Nishant Kumar, if you have any thoughts, any feedback, or any question, please feel free.
Sir, they are from Amrita only, so they joined on behalf of.
Perfect. I could see that they are one of the panelists to the session, so I thought of just reaching out to them. And
Dr. Pawan, actually, right now we are also having this inauguration of our annual conference of as IUH Karnataka branch in Bangalore. So many of our members, they are busy over there, so they couldn't join live, but they all will be going through this video, which will be uploaded soon. And we would also like to, you can invite Amrita Hospital and the learned speakers for the Occupon 2023 conference. Dr. Pawan.
Yeah, thank you so much, sir, for emphasizing on it. I was thinking of mentioning that, yes, right now there's an event going on in the country. Karnataka branch is hosting its annual conference of occupational health physicians, and many of our national stalwarts, national level stalwarts, are probably either part of it or have joined live to be part of that. So that's why they could not. But then we are going to share this information with them. And as Dr. Sharma has just mentioned, so here is the page, Dr. Vishwanathan and Dr. Rishabh. This is the national conference that we are hosting, for Delhi branch is hosting. This is a national event which has come to Delhi after this is the fifth time that, if I'm not wrong, or fifth time we have got this opportunity to host this national event. This is the 73rd annual national conference, and we humbly and wholeheartedly invite the entire institute to collaborate with us, to join hands with us, to attend in their own capacity, and we will definitely share more details.
Sure. Okay.
For sure. We will be, your team will be in touch with us. Our team will be in touch. We'll discuss more on this, and we will definitely love to know much more and have more deliberations regarding institutes' capacities and what our great work is being done. Definitely, Dr. Kamla Fartyal is our conference chairperson, and she was also present, and she has also emphasized. So we look forward to shaking hands for this grand event as well. And we definitely keep doing a lot many events, because this is our forte. That's what we have been able to do. And 105th session speaks tall about what we have been able to achieve in last 2.5 years. Yes. So we definitely would like to, and it has been unbroken till 100th session. After that, we have given it a pause, and we definitely keep collaborating and keep learning. So I once again wholeheartedly invite you for this grand event. And I can see that I have been able to reach out to all the panelists and then attendees. I have announced if they have any questions, they will post it to us. We will reach out to you. We'll keep bothering you with their queries.
No problem.
And with that, I think we have come to end of this session. Any final thoughts from your side, Dr. Vishwanathan and Dr. Rishabh?
We are open to collaborate with each and every one of you. In clinical services or in research services, anything. So, and also the screening programs also, in which as one of the audiences had a question that about the screening programs, and of course, cancers detected early are always curable. So we would look forward to have a long-term collaboration with all of you.
Thank you so much. I'm really thankful and filled with gratitude for your kind gesture and also the generosity that you have shown. Once again, appreciate you for sparing your time this fine Saturday evening. We have learned, we are going to keep this knowledge with us and also disseminate among other fellow medical fraternity people, and we'll keep reaching out to you.
And also we would like to invite all of you to come to our center. We will take you around.
Thank you so much. That's very
And if I may just add one more point, that is, see, we are adding one more point regarding cancer research, because without cancer research or any research, we cannot move forward as a country. You have seen that in COVID-19.
Yeah.
So you need to understand that the medical oncology research is driven by big pharma. It's profit driven, and some of it will not have the right results for the patient. But we in radiation oncology, we cannot generate the money for research from big pharma.
Okay.
We are dependent on CSR initiatives, NGO, ICMR to get funds from these institutes to run clinical trials, and then make people benefit. Because in clinical trials we have to give treatment free of cost. That was possible in AIMS, but we need to do that here at Amrita also. So we would be very much, thankful to you if you could help us, connect with people who will be able to fund the cancer research, connect with people with CSR initiatives from various companies, especially for the big giants, as you said. Now, all the big companies, and if you have a good contact, we would be humbled and honored to receive the money for cancer research. And so that we can use that for the benefit of the patient via the CSR initiative.
Absolutely.
Because as part of the lecture, you might have heard that Rishabh has he has done one of the pioneering work in benign diseases, the role of radiation in benign diseases, and I have done a lot of work as a pioneering effort in robotics in treating cancer. So if we could do some sort of a collaboration in these aspects to get some sort of a grants, and if you could help in those, it would be very much. And our focus in the future would be driven by artificial intelligence also, as Rishabh was pointing out. So all of these factors we can take into consideration and cohesively go through the entire process.
Absolutely brilliant. It cannot be more generous and more open that you are taking this philanthropic approach while working for the patient, for the masses. We would be definitely glad if we can collaborate, and definitely commercial aspect also can be taken care. As just for your kind information and just to keep you updated, you are speaking directly to one of the key decision makers in that entire cycle.
Okay.
You are directly interacting with that body. I will just say that, because as you heard Dr. Sandeep Sharma, he is the general manager HSE at Indian Oil. You heard Dr. Kamla Fartial, she is head of the medical at NHPC. And then you name all the organizations as I've given in the beginning. All medical heads definitely are part of this organization. So it's a direct communication. Yes, you can definitely reach out to them with all the work, and we will keep interacting, and the information will pass on to the key stakeholders at large, and we will see how best we can synergize this and how best two organizations come together for the research work as well. For sure.
Sure.
With that, thank you so much for your time, and we are towards the end of this session. We look forward to interacting with you more. Thank you.
Namaste Shivaya.
Namaste Shivaya.